we acknowledge that young married girls tend to be a very, vulnerable group because of various reasons. If they are young married girls, we're assuming that they're probably married at an age before, probably before 18. They could be married either before or around the age of 18, and we know how. That we also know that the pregnancies before the age of 18 are associated with higher risks of complications as compared to pregnancies after the age of 18. We also know that these girls are very often married to men who are older than them, men who might already have other wives, and that there is pressure for them to have their first pregnancy very soon. So they find themselves isolated. In addition to that, because they're married young, they might not have the information they need to be able to either access services to example, attend antenatal care on a regular basis, or to be able to space their births once they've had a child. So in countries such as Malawi, we actually have a research study and this is a male-motivated research study, where we're working with their husbands. What we have done is we have trained male motivators and taught them to identify couples where the husband is married to a young wife and with an age difference of about 5 to 10. So we are assuming that she's probably around 15, 18 and he's over 25. And we have trained them to be able to reach out to the husbands, try and reach them with gender sensitive messages, and also information about the importance of spacing and delaying first pregnancy at least until the age of 18. And we are going to be so this is a research study that's currently underway, and we're going to be documenting and looking at the findings, and just to see whether this is something that we could be using in our other programs. But you definitely want to make sure that the girls are reached either through their husbands or through programs such as working with peer educators to reach them with information that they need to be able to access services that are appropriate for them, and also to ensure that providers in the services are youth-friendly and sensitive to their needs. Very often, these are girls who are not, when they have the courage to go to a health center, they might not be welcome there, and then the providers might not be sensitive to their specific needs. So you need to be working on both ends of the spectrum, not only working with the mother-in-law, the husband, the partners, and the family members, but on the other side also with providers, to make sure that they have the information they need to be able to tailor their services to their need. And they need to be technically up to date on the services that are appropriate for them. The fact that a young girl who has the first pregnancy before the age of 18 might have obstructed labor because her body's not ready, to be able to monitor her if she comes in with a pregnancy, to be able to give her the information she needs in terms of nutrition, but also ensuring that the provider has the information that he or she needs to be youth-friendly or to be perceived as youth-friendly. We know also from some of our, we do surveys with our providers and interviews, and from asking them, some of the biases actually imposed by providers are not based on medical eligibility criteria. So sometimes if you ask a provider what is the minimum age for using injectables, they'll say a woman needs to be 25 and have had 3 children. That's not in the medical eligibility criteria.